We've all been there, right? That miserable, throbbing, can't think straight pain of a bad earache. But what is actually going on inside your head when that happens? Well, today we're going to break down the anatomy of an earache so you know exactly what your body is trying to tell you. Yeah, that sharp, relentless pain is way more than just an annoyance. It's your body waving a big red flag. It's a distress signal. So what's it trying to say? Let's dive in and find out what's really happening in there. Okay. So, the fancy medical term for this whole situation is otitis media. At its heart, it's just inflammation of the middle ear, that tiny air-filled space right behind your eardrum. And it's usually kicked off by an infection, which is often a nasty little souvenir left over from something like the common cold. But here's the thing. Otitis media isn't just one single problem. It's really more of an umbrella term. And to truly get it, we need to break down the three main types of trouble that fall under it. So let's look at the main differences. First up, you've got acute otitis media, or AOM. That's your sudden, active infection, complete with pus. Then there's otitis media with effusion OME, which is all about a buildup of non-infected fluid. You've probably heard this one called glue ear. And finally, you have the chronic version, CSOM, which is defined by a discharge that just won't quit. So the key thing to remember is simple. It all comes down to what's trapped behind that eardrum. Is it pus, fluid, or something else?
All right, let's start with AOM. This is the classic ear infection most of us are unfortunately familiar with. It hits you fast and hard with some serious pain. Doctors call it altalgia, and often a fever comes along for the ride. If a doctor were to take a peek inside, they'd see that telltale sign, a bulging, angry red eardrum.
Next up is OTE, or glue ear, and this one is a lot sneakier. See, here the fluid builds up without an active infection, so it's usually painless. The biggest giveaway is muffled hearing, like you have cotton balls in your ears. In kids, this is a really big deal because if it goes unnoticed, it can actually lead to speech delays. It's a silent condition, but a potentially serious one. And finally, we have the chronic version, CSOM, which really splits into two different paths. The first is the Tubotympanic type, which they call the safe type. It involves some mucus discharge through a little hole in the center of the eardrum. But then there's the Atticoantral type, and it's called unsafe for a very, very good reason. This one can create something called a Cholesteatoma, a destructive skin cyst that can actually erode the tiny, delicate bones inside the ear, and that can lead to some really serious complications. So, that covers what these conditions are. But that brings us to the next big question. How does this all get started? Why do our ears get into this state in the first place? Well, the problem often starts when the Eustachian tube, think of it as the tiny drainage canal for your middle ear, gets blocked. That inflammation can come from a cold, the flu, or even bad allergies. And when that drain gets clogged, fluid gets trapped, creating the perfect breeding ground for an infection. In kids, this can be made worse by things like enlarged adenoids, a cleft palate, or even just how they're bottle fed. And of course, your overall health and nutrition play a role too. So you have the symptoms. You go to the doctor. How do they figure out exactly what's wrong? Well, it's a bit like detective work, really. They start with the most obvious clues and then move on to more advanced techniques if needed.
The whole diagnostic journey usually kicks off with a simple clinical exam, looking inside your ear with an otoscope. From there, depending on what they find, the next steps could be hearing tests, lab work on an ear swab, or in really complex cases, a CT scan to get a full picture of all the inner structures. And honestly, that first look inside the ear is absolutely crucial. It's the starting point. Is the eardrum red and bulging, screaming acute infection? Or is it kind of dull and pulled inward, which points to fluid buildup? This simple visual check provides the foundational clue that guides every single step that comes next. And here's a great example of how the testing can nail it down. A test called tympanometry measures how well the eardrum moves. If the results show a flat line, what they call a type B curve, that's a dead giveaway. It tells the doctor the eardrum isn't moving right because there's fluid stuck behind it, a classic textbook sign of glue ear. All right, so we know the types, we know the causes, and we know how it's diagnosed. Now let's get to the most important part. What can we do about it, and how do we keep it from happening again?
The big thing here is that treatment is definitely not one size fits all. A painful AOM, that's usually treated with antibiotics and painkillers. But for really severe pain, a doctor might perform a myringotomy, which is just a tiny incision to relieve all that pressure. For OME, it's often a case of watchful waiting, but if it keeps coming back, they might insert grommets, which are little ventilation tubes. And for that dangerous CSOM with a cholesteatoma, a surgery called a mastodectomy might be critical to remove the infected bone.
So, How do you prevent all this in the first place? A lot of it comes down to simple but really powerful habits. Treating colds and the flu quickly, staying on top of vaccinations, and making sure infants aren't bottle-fed while lying down can make a massive difference. And for anyone who deals with chronic ear problems, keeping the ears dry is absolutely vital.
Now we're going into all this detail for one really key reason. An ear infection can be so much more than just a bad day or a sleepless night. If it's left untreated, the consequences, well, they can become incredibly severe.
An untreated infection can actually spread from the ear to all the critical things surrounding it. This seriously raises the risk of things like meningitis, facial nerve paralysis, severe vertigo, and even permanent hearing loss. And that is exactly why an earache is never something you should just ignore.
And that's really the bottom line. Ear pain, muffled hearing, any kind of discharge, these aren't just symptoms you're supposed to endure. They are your body's early warning system. Paying attention to them and getting the right care is the crucial step that stands between a temporary problem and potentially permanent damage.
So the next time you feel that telltale twinge, remember what's happening deep inside. It's a complex process, for sure, but the message itself is simple. Your body is sending you a signal. The only question is, are you listening?